Did you know that most unborn babies, they have a hole in their heart, and then when the mother gives birth and when the baby takes their first breath, the hole in their heart automatically closes. But in some cases, which it's not rare, but it's not common, so it's like an uncommon thing, the hole in the baby's heart doesn't actually close properly, which can lead to heart problems, breathing problems, and it can kind of just
Health problem.
yeah, basically. Tetralogy of Fallot is really a combination of 4 heart defects. There's a hole in the septum between the right and left ventricles, a blockage between the right ventricle and the lungs, and a large right ventricle and improper balance aorta. Infants with tetralogy of Fallot often look like their skin is blue. This is because the defects prevent the blood from getting enough oxygen. This blood looks colored. Babies who are born with this condition need surgery. Sometimes 2 surgeries are needed. The first surgery improves blood flow to the lungs and decreases the blue color of the skin. The second surgery clears the blockage between the ventricle and the lung patches in the hole in the septum. Both of these can be performed when parents and healthcare providers can do things that make life a little easier for children with the tetralogy of Fallot. For example, feeding a child more slowly and digesting. This can help the level of oxygen in the blood stay higher. If the child has blue lips or fingernails from the lack of oxygen in the blood, lying in a neat chest position can help. Giving a child oxygen through a breathing mask also helps. The word transpose means reverse. In TGA, the aorta and pulmonary arteries are switched. The aorta receives the blood, and that is not the oxygen-rich.
Louder.
So certain fluids in the chest, arms, and legs.
Honey, I can hear. Can I hear it, please?
I thought you already read this stuff.
Not this book. Come on, go ahead.
Heart disease? You're doing this just so you can hear. These sensitive electrodes doctors can tell whether a person's having a heart attack or has recently had one based on the EKG results. Blood tests can also show whether a person's having a heart attack. During a heart attack, special chemicals are released into the bloodstream. Medical staff can test to see if any of those chemicals are in the blood. Once the doctors determine that a person's having a heart attack, the patient will usually be given medication to prevent any more artery blockage. Another medication a person is experiencing a heart attack may receive nitroglycerin, which is sprayed under the teflon more easily, and the heart can stop working so hard. Medications are called clot busters, can also be given to help dissolve any blood clot that might be blocking a blood vessel. A doctor will decide which medication will work best for each patient. Sometimes a person suffering from a heart attack will need surgery to open a blocked coronary artery. One surgical procedure that does is an angioplasty. Doctors insert a small balloon into the artery and inflate it. This presses the plaque against the artery wall, leaving more room for blood to flow through it after the balloon is removed. After angioplasty, sometimes doctors insert a stent into the artery. A stent is a wire mesh tube that holds the artery open. Another surgical procedure for heart attacks patients is a coronary bypass surgery. Doctors take a vein from somewhere else in the body and use it to replace the blocked coronary artery. The vein is often taken from the leg or chest. Doctors connect the vein into the coronary artery on both sides of the blocked area. Blood then flows through the piece of vein, going around or bypassing the blocked area. It is common for a person to have 3 or 4 coronary arteries fixed this way during one single surgery. High blood pressure. High blood pressure occurs when the force of blood through the arteries is too strong. It's also known as hypertension. The cause of hypertension is known in many cases, though plaque buildup in many of the body's arteries is one cause. Blood pressure can be measured at a doctor's office or at home with a special device called sphygmomanometer. Do you know how to say this word?
Different type of. Long names.
Part of the device is a cloth band that is attached around the upper arm. Attached to the band is a pump, which inflates the band with air. This tightens the band and stops the flow of blood in the arteries for the arm just a moment. The air is let out gradually, and the pressure of the blood in the artery is measured as the blood begins to flow again. A doctor or nurse can tell when the blood is flowing again by listening for its pulsing. With the aid of a stethoscope, a blood pressure reading has two numbers. The first is called a systolic pressure. The systolic pressure measures the pressure in the arm's artery just after the heart squeezes and forces blood into the artery. The second number is the diastolic pressure. The diastolic pressure is a pressure of blood when the heart rests for a moment between beats. A complete diastolic reading, for example, if the systolic reading is 120 and the diastolic reading is 80, a doctor would say that the blood pressure is 120 over 80. A healthy blood pressure reading is under 120 systolic pressure and under 80 diastolic pressure. A systolic reading between 120 and 139 and a diastolic between 80 and 89 are considered pre-hypertension. Pre means before, so pre-hypertension means that the blood pressure is not normal, but not yet high enough to be called hypertension. Readings over 140 systolic and 90 diastolic indicate hypertension, which is very dangerous. When a person has high blood pressure, the heart must work harder to force the blood along, and the arteries are under more pressure than is healthy. Hypertension can increase a person's risk for other heart problems such as heart attack and congestive heart failure. If a person with hypertension does not experience any symptoms, this is one of the reasons it is so dangerous. A person can have hypertension for years and never know it. But once it is diagnosed, it can be treated through medication, exercise, and diet. Arrhythmia. Just like keeping in time with music, the heart beats to a rhythm. About the average adult heart beats around 60 to 90 times per minute, depending on the size and the age of the person. When the number of beats goes up while the person exercises and goes up for a while afterward, an arrhythmia occurs when the heart rate is abnormal. Tachycardia is when the heart beats too quickly. In some instances, tachycardia can cause the heart to become too large. This is because the heart is working harder and the muscle grows, just like running. Certain kinds of tachycardia can be dangerous. And can quickly cause a person to lose consciousness or die. Bradycardia is when the heart beats too slowly. A person with bradycardia might feel lightheaded, dizzy, or faint. Treatment for arrhythmia depends on what kind of how severe it is. For most mild cases, lifestyle changes like quitting smoking, avoiding caffeine, and managing stress, and avoiding certain medications can be enough to stay healthy. More serious arrhythmias require medication and sometimes surgery. Medication is used to control the rhythm of the heart so that it remains close to normal. People taking medication for arrhythmias need to check their pulse regularly. There is different surgical procedures that are used for different arrhythmias. Bradycardia is treated by a pacemaker near the heart. This is a small device that detects a slow heart rate and delivers an electrical impulse to stimulate the heart to beat at a normal rate. Tachycardia is sometimes treated with a surgical procedure, which is implanted in the cardioverter defibrillator, or ICD, is placed in the chest. An ICD corrects a fast heart rate. For sudden cases of irregular heartbeat rhythm, a person must have immediate medical attention. A very strong electrical shock can be given using a portable defibrillator machine. This can set a heart's own rhythm back to normal. Congestive heart failure affects 5 million Americans. When a person has congestive heart failure, the heart does not pump as well as it should. This can be due to weak heart muscle or leaky valves. This can happen on the left sides of the heart, on the right sides of the heart, or on both sides. When it affects the left side of the heart, blood coming back from the lungs collects in the heart side. The bloods may then leak backwards into the blood vessels of the lungs. This creates breathing problems and causes fluid to build up in the lungs. When congestive heart failure affects the right side of the lung, blood returning to the heart collects on its right side and back up in the veins. As blood collects in the veins, it causes swelling in the body, especially in the abdomen and legs. Congestive heart failure usually does not occur by itself. The heart is often affected by other kinds of heart diseases as well. This might include a previous heart attack, hypertension, an infection, a congenital heart disease, or an arrhythmia. Any of these conditions can make the heart a weaker pump. If left untreated, it can lead to congestion heart failure. To treat congestive heart failure, doctors must first treat the disease that led to it. Sometimes, especially when the hypertension or blocked arteries are to blame, the condition can be reversed. Other times, the damage to the heart is permanent. Doctors and scientists have found more interesting ways to help patients whose surgeries are damaged. One of these are valve replacement surgery. This surgery involves removing a valve in the heart that is not working properly. A new valve is inserted in its place. A new valve can be from a donor heart or an artificial valve that is man-made. Heart surgery is heart transplant. In a heart transplant, doctors remove the diseased or damaged heart and replace it with a healthy heart of somebody who has recently died and donated his or her heart. About 100,000 people need a heart transplant each year, but there are not enough donor hearts. Patients who have received transplants must continue to take medication that prevents their bodies from rejecting the new heart. They must also see their doctors regularly for the rest of their lives. Despite the seriousness of the heart disease, that does not mean a person's life is over. If symptoms are caught early enough and with proper treatment is followed, it is very likely that people with heart disease can go on to lead normal lives. It helps to know how the heart works and learn about what can go wrong and what aware of the factors increasing the person's chance of heart disease. History of heart disease. For thousands of years, humans have known about the importance of the heart. In ancient Egypt, doctors understood little about the heart. They believed it was essential, meaning for the point of vessels. These vessels carry all different body fluids throughout the body. This included blood, tears, and urine. While these doctors were wrong about tears and urine, they were right to associate the heart with blood. Ancient Egyptians used herbal remedies like aloe vera, juniper, mustard, and onion to soothe chest pain and heart problems. Look. Can I have a hug? For thousands of years, humans have known about the importance of heart. In ancient Egypt, doctors understood little about the heart. They believed it was about the central meeting point for vessels. These vessels carried all of the different body fluids throughout the body. This included blood, tears, and urine. While the early doctors were wrong about the tears and urine, they were right to associate the heart with blood. Ancient Egyptians used herbal remedies like aloe vera, juniper, mustard, and onion to soothe chest pain and heart problems. Over the years, as technology improved, scientists and doctors learned more about the human heart. Many scientists dissected hearts by the people who have died from heart problems. By examining the heart structure, they were able to develop theories of how the heart worked, what went wrong, and what could have been done to treat the heart problems. The invention and improvement of medical devices like microscopes and stethoscopes can also be helped. Surgery for different body parts can become more common. Surgical procedures were practiced and improved as time passed. Patients were most likely to survive after serious heart surgeries. The heart was considered to be too delicate to be treated directly with surgical treatment until the last 100 years. During World War I, military doctors were faced with the task of treating soldiers with heart injuries. Many soldiers had pieces of metal or bullets stuck in their hearts. One of the first doctors to attempt heart surgery was Dwight Harkin, an American military doctor. He tried heart surgery on animals first. Dr. Harkin found that he could make a small hole in the heart and reach in with his fingers to remove objects that did not belong in the heart. Soon he felt ready to try his technique on humans. He was able to remove pieces of metal and bullets from the soldiers' hearts. Luckily, all of his patients lived.
Wow.
But the technique was not useful for other types of heart disease that were not caused by injury. For example, serious heart defects required opening the heart. but doctors were afraid to open up a person's heart for major surgery because the patient would bleed to death.
Right.
During the late 1940s, a Canadian doctor named Bill Bigelow, I think that's how you say it, Bill Bigelow, tried to figure out a way to help a patient through major surgery. He knew that when bears hibernated in winter, their hearts beat much more slowly and the bodies need less oxygen. Dr. Bigelow thought that it might be possible to put human patients in something to the state of hibernation by cooling them down, when a doctor could operate on the heart and warm them up again after the surgery was finished. In 1952, Walton Lillehei and Dr. John Lewis used his theory to operate on a 5-year-old girl who had patent ductus arteriosus. They cooled her body down, which slowed her heart. They knew they would only have about 10 minutes to fix her heart before the lack of oxygen would affect her brain. The surgery worked. They were able to repair the problem and warm the girl back to a normal temperature. This type of surgery, however, cannot work for all heart defects because the surgeon only had a few minutes to work on the heart. If the heart defects were serious or extensive, a few minutes would not be enough time to operate. Another problem with the early form of open heart surgery was that the heart was still beating and moving during operation. Although it was more important to keep the patient alive, it made it very difficult for a surgeon to operate on the heart itself. The next major development in the heart surgery was the invention of the heart-lung machine. In 1958, doctors perfected a machine that would temporarily fix the heart. The heart-lung machine draws blood out of the body through a tube, cleans it, adds fresh oxygen, and pumps it back into the body. This gave doctors much more time to fix the heart. Doctors also invented a medication to use on the patient during the surgery that temporarily stopped the heart from beating. This medication, along with the heart-lung machine, has a very important improvement for the heart surgeons and their patients. An important role which these advances play, in addition to saving lives, was allowing doctors to see diseased hearts up close for the first time. When Dr. Harkin and Dr. Bigelow were found performing in some of the heart surgeries, they often found other problems within the heart that they did not expect. Before open heart surgeries were performed, doctors had only been able to make educated guesses about the heart problems. They can now see the problems up close. New technologies also helped. Chemical tests and other devices were created to help observe the heart and its functions. New medications such as antibiotics help people recover after heart surgery. In the 1960s, doctors attempted heart transplants. These surgeries were performed on people whose hearts could not be repaired. A healthy donor heart from a person who just died was surgically placed into the chest of somebody who has his or her heart disease removed. These were complicated surgeries that took a lot. I'm gonna beat you in checkers again.
Give her a hug.
I'm so tired. I'm reading about heart disease.
You know, I'm making Among Us.
What? You're the imposter.
No, I'm not.
Yes, you are. You're the imposter.